Hey guys, welcome back to my channel. This is Dr. Prasanjit and you are watching Prasu'S Medledge series. I hope you all are doing good and have watched my previous videos. If not, what are you waiting for? Go for those after the end of this video. Now without wasting any time further, let's get into today's topic. So guys, today I'm going to discuss the topic lung abscess. I have already discussed this topic in detail in one of my previous videos. You can check out that video by clicking on the I button. And today I'm going to discuss this topic in a different way, that is with the help of a single flow diagram. So before exams, you have to just go through this and you are good to go with this topic. So guys, what is lung abscess? So from the word abscess, we can understand pus. So lung abscess is a pus-filled cavity with necrotic debris within it, and it is a pus-filled cavity which is present within the lungs. So it is called as lung abscess. Here you can see lung abscess. Okay. Now coming to the causes of lung abscess, we can divide the causes of lung abscess mainly into two categories. First is aspiration of nasopharyngeal and oropharyngeal contents, and this is the most common cause for lung abscess. And then we have other cause, that is infection. So it can be either in the form of pulmonary TB, it can be in the form of bacteremia, it can be in the form of secondary infection of a cavitary malignancy. So these are the causes for lung abscess. The most important cause and the most common cause being aspiration of the nasopharyngeal and the oropharyngeal contents, and this occurs when the person is in unconscious state or when there is depression of the cuff reflex of the person. Now coming to the clinical features of lung abscess. So basically the lung abscess can present either as an acute presentation or it can have a chronic presentation. So acute presentation is basically less than 1 month of symptoms, and chronic presentation is basically more than 1 month of symptoms. So you have to remember only few things in this, that is fever, then we have chest discomfort, then we have cough. Okay, so these three features will be seen in both acute presentation as well as in chronic presentation. But acute, as you know, is a serious thing, so fever will be high here, whereas in chronic presentation the fever will be low. Then chest discomfort remains the same for both. In acute presentation, the cough will be initially dry, that is there will be no sputum production, that is there won't be any expectoration. But when the lung abscess ruptures into a bronchus, as you can see here, when the lung abscess ruptures into a bronchus, this is the bronchus and this is the lung abscess. So in that case, the patient will start expectorating, that is the sputum will be produced, so the cough turns into wet cough. Whereas in chronic cases, the cough will be wet cough from beginning itself. So the sputum which is being produced in case of acute or chronic presentation of lung abscess, it will be foul smelling, that is it will be having a putrid smell. So these were about the symptoms which we see in lung abscess. Now coming to the signs seen in lung abscess. On general examination, we will find pallor, then fever, because as I have already mentioned, fever is one of the symptoms, so fever is also one of the signs. Then finger clubbing is one of the important signs which we see in case of lung abscess. Then we have halitosis. What is halitosis? Halitosis is bad breath, that is foul smelling in the breath. This is because of the production of the foul smelling sputum. So that is what we find in general examination in case of lung abscess. Now coming to the respiratory system findings, which is also coming under the signs, we will get dullness on percussion on the area of lung abscess. Then there will be increased vocal fremitus and increased vocal resonance. Then we can also get bronchial breathing. The reason for all these three findings are the same, that is lung abscess adds a fluid compartment in the normal air-filled lungs. As a result, on percussion we get dullness, there is increased vocal fremitus, there is increased vocal resonance, and we get bronchial breathing also. Now coming to the investigations which we do in case of lung abscess. First is there will be elevated ESR, because most of the etiologies that is responsible for causing lung abscess includes infection, that is pulmonary TB, then we have bacteremia, then secondary infection of the cavitary malignancy. Now coming to the next thing, that is imaging. So we can do chest x-ray and we can do CT thorax. Okay, so in chest x-ray, as you can see here, the red arrow is showing the lung abscess. You can see there is a air fluid level. Okay, that upper area is air and the lower area is the fluid part, that is the pus, which is present within the lung abscess. Also in the CT thorax, you can see the red arrow which is showing the lung abscess. Here also you can see the fluid has been settled in the dependent part, and just above that lies the air. Okay, now coming to the other findings, it includes anemia and increased WBC, that is leukocytosis. Anemia, how you will remember this, because in general examination, we have found pallor in case of lung abscess. So pallor is seen in case of anemia. So from that you can remember that anemia is one of the finding, and because it is an infectious state, so the body has to give a response against the infection. So in that case we will have increase in the number of WBCs, that is leukocytosis. Now coming to the complications of lung abscess, it includes hemoptysis, which leads to anemia leading to pallor. Then we have pleural effusion. This occurs when the lung abscess ruptures into the pleural cavity. As you can see here, the lung abscess is rupturing into the pleural cavity. Then we have pyoneumothorax, that is presence of pus and air both within the pleural cavity. Then we have empyema, that is presence of pus in the pleural cavity. And we can also get another complication which is called as bronchopleural fistula. What is bronchopleural fistula? Bronchopleural fistula means the pus which is present with the lung abscess first communicates with the bronchus, and the bronchus and the pleural cavity gets connected together. This is called as bronchopleural fistula. Then because lung abscess is a inflammatory condition, so after that there will be a process of healing also. So because of the healing, it leads to fibrosis around the area of the lungs where the lung abscess was present. So fibrosis is also one of the complications of lung abscess. Now coming to the management of lung abscess, it includes postural drainage plus chest physiotherapy plus antibiotics. And antibiotics include Moxclav, that is amoxicillin plus clavulanic acid, that is 625 milligram is the dosage given TID, that is 3 times a day. In case of a large lung abscess, we can do percutaneous aspiration, as you can see here. With the help of a needle which is inserted into the lung abscess area, we just aspirate the abscess, and along with that we can put a pigtail catheter, which you can see here. This is the pic of a pigtail catheter. So pigtail catheter and percutaneous aspiration is done in case of a large lung abscess. So guys, this was about the topic lung abscess. Now I would like you guys to take a screenshot, because if you take a screenshot, you will not have to go through this process of watching the video again and again. You will just have to go through the screenshot and you are ready for this topic for your exams. So I hope you like the video. If you like my content, please do like, share, subscribe, comment, and also press the bell icon to get notified whenever I upload a new video. Thank you guys.